Hello.
Hello.
Hey, sir, how are you?
Good, how
Jonathan
about
Knuckle.
yourself?
Nice to meet you.
Nice to meet you.
How are you doing?
Pretty good, I reckon. Or maybe not quite real good. That's the reason I'm here, I guess.
Well, what's bothering you? I know
Right.
you have the multiple myeloma, and there's some areas...
Well, actually, I don't.
No. Did I mix up patients? No.
No, well, he thought I did when he first talked to you.
Yeah.
But the results came back negative of the bone marrow.
Oh, okay.
And then he thought I had sarcoidosis.
Uh-huh.
And that actually came back negative. I just met with him yesterday.
Oh, okay.
So, so he's like 98% sure that I do not have multiple myeloma, and he just saw this spot that he thought was sarcoidosis on my spine. And I'm talking, of course, to Dr. Eunice.
Yeah.
So, this all started because I've got a hip replacement, and my hip was hurting.
Okay.
And my orthopedic surgeon saw something weird going on with the initial MRI.
Let's go through the pictures, because... there's, I don't want to be Debbie Downer, but there's something going on in the spine. See all these little white lesions?
Yes, sir.
Usually if it's a hemangioma, which is a benign tangle of blood vessels in the bone, it's circular. This looks like a destructive process. Here, there's a compression fracture here. The bone is irregularly shaped. This is what I see. There's enhancement in the back. I'll talk to Dr. Eunice. And then let's look at the thoracic spine. It's mottled. Like there's little lesions all throughout the spine. You also have a little bit of compression of the spinal cord here. Mm-hmm. It's touching it. It's not pinching, it's touching it. How's your walking?
Well, walking's bad because my hip hurts. I do have some tingling, and I have feeling, but it's tingling, a little numbness in my feet, toes.
Both of them?
Yes, sir. It's been like that for a couple of years. It's gotten worse.
Yeah, I don't want to treat you like an arthritic patient until we rule out this looks to me like multiple myeloma. Let me call Dr. Eunice.
Yeah, because he did a bone marrow biopsy.
Yeah. I was reading his last, maybe he didn't put his new note in the computer, that's why I'm a little... Alright. The good news is, okay. Dr. Eunice wants me to do a biopsy, an open biopsy to get more tissue.
He identified one particular spot.
Let me talk to Dr. Eunice.
Somewhere that he showed me and said, this is what he needs to do the biopsy on. And of course, I don't know where, but it was he showed it to me. It was,
well, what I could do is treat two problems at once. This is some arthritis of the spine here. And I could go in and biopsy the vertebral bodies, put screws and rods in to hold everything together. I do worry about multiple myeloma. There's a high rate of compression fractures. And in the thoracic spine, I can throw screws and rods in left and right. I take away absolutely no motion. Mm-hmm. So people talk, motion in the neck. If you put screws and rods in, it won't move in the spine. But in the thoracic spine, hopefully that's the area he wants me to biopsy.
Yeah, I mean, again,
I'm gonna call him. Don't
yeah,
worry.
I just don't.
Yes, sir.
I don't have any. I mean, I know it's obviously that you see what you see. I don't have any pain or
Yeah.
you know.
No,
It's
just
just
sensory changes in both legs. All right, let me.
and like I said, the original MRI of my pelvis, you know, where Dr. Ingerson was looking at my hip replacement, showed, you know, the bone's deteriorating, and he saw all these spots in the bone, and it's like,
This, you know, your CT chest side and pelvis was negative, the bone is positive. My mind goes to multiple myeloma every day. Lymphoma maybe, but all right. Let me talk to Dr. Eunice. And let me see if he'll answer. Give me a second.
all right.
What's going on? we'll do that thoracic spot. Look, this is it's a pretty safe operation. I do this with navigation, so all my hardware is perfectly placed. I typically do hardware in the thoracic spine because I'm going to treat you like it's multiple myeloma. If it's not, I don't think we lose anything. If it is, we gain a lot. People with cancer in the spine, they'll ultimately get compression fractures and go like this, and that'll pinch the spinal cord. So I put screws and rods in to hold everything together. The risk is extremely low because it's done with navigation. So all my screws are placed with laser guidance. I mean, not really a laser, but it is. I've never had to revise a screw, ever. Number one. Number two, you don't lose any motion. So I do it with impunity. I could do T1 to T12, thoracic, top to bottom. You don't lose any motion. I'm not doing that much though. Basically, traditionally I do 2 above, 2 below. That's how I was. That's how I typically did it when I was working up at Brown, and now I'm here. I'm going to take this piece of tissue out right here. I do think this is just ligament, just a thick ligament, but I'll be able to go in the bone and take some more tumor out in the bone, if that's what this is. I'll get a big piece for the pathologist so we can get a definitive diagnosis. Dr. Eunice uses a small needle. I use a larger instrument to do it. So we'll do T.
So there's a potential that the bone marrow he got out didn't contain.
Sampling error. There's a chance that it was negative. And this is too concerning in my mind to just leave it to that.
And he reiterated again yesterday when I did I guess I turned in a 24-hour urine sample, and said there was no evidence of cancer.
That is true, and I could be wrong too, but this MRI is concerning enough where I would not wait.
Right.
Like, I'm not rushed to surgery.
Obviously, I want to do it.
Yeah.
I mean, I'm just kind of bummed out because I thought it was not, and now you think it is, but
it looks like it is on the pictures. It really does. I mean, this is typically what multiple myeloma does look like, and this is why Dr. Eunice did the bone marrow biopsy, but he did not do it in the spine. He didn't do the biopsy in the spine, correct?
Mm-hmm. No, he did it in my hip.
So I'm gonna get a piece of it in the spine where we see the changes on MRI, and that'll give us a definitive diagnosis.
All right.
If it makes you feel better, everyone in the city sends me all their thoracic cases. Every single senior and junior spine surgeon. So this is something that I do almost exclusively.
Yeah. No, I mean, I have no concerns with that. It's just,
And myeloma has a good prognosis. It's a very treatable problem. Very treatable. If that makes you feel better too.
Like when you say treatable, because obviously
95.
Google is terrible. When you look that up, it's like, okay, from diagnosis, it used to be 5, now it's getting close to 10, but I mean, I don't.
No, everyone responds a little differently, but myeloma is, if you have to have a problem, this is one of the best ones to have. Is that a fair assumption? I mean, the 10-year survival is good, and if you have a 10, usually when you're talking about lung cancer, you're in the 2 to 4 year survival. Breast cancer, 5-year survival. Prostate, 5-year survival. Myeloma is better. So it's definitely a very treatable problem. And a lot of people with myeloma, that data takes in all patients. So people with myeloma also come in with paralysis because it's the spine. You don't have any serious compression. Any other medical problems?
No, like I said, just diabetes.
All right. Any aspirin?
High blood pressure.
Any aspirin, Plavix, blood thinners? All right.
Atorvastatin, metformin, glipizide, Trulicity.
All right. I want you to see your medical doctor for clearance for a thoracic decompression, fusion, and biopsy. And we'll get this on the schedule pretty quickly because this affects your treatment, if there is any indicated. If there's,
So obviously you haven't seen what that looks like and it not be multiple myeloma before.
it's, you know what, it's not inflammatory. It's not an infection. Infection goes to the disc space because it follows the poor blood supply. Discs don't have blood vessels. Is it sarcoid? I personally have not seen sarcoid look like this. Sarcoid looks usually has an extra, usually has a more soft tissue component. This is all in the bone. If it's not multiple myeloma, I'll be extremely surprised. How about, I mean, I do think it's multiple myeloma.
Alright.
If you have any questions, sir, please call me. I'll see you as many times as you'd like to, and we'll schedule the operation.
So
My nurse will call you, but I want you to see a primary care doctor for clearance for an operation. But I will proceed with the operation regardless. I'm still going to book it and go forward.
Okay.
So if you can't meet with him in time or her, we're still going to proceed. I mean, this is pretty, I don't want it to get to a point where I'm decompressing the spinal cord.
Mhm.
That's more serious.
all right.
Yes, sir. Wait 1 second. Ashley will be here. Ashley?